Hello and welcome to the Network of Care for Public Health, Assessment and Wellness. The Network of Care for Public Health is a project developed in partnership with the National Association of County and City Health Officials, NACCHO, and the National Association of Counties. The purpose is to provide policymakers and stakeholders with the best possible information to make decisions that improve the quality of health. Our efforts involve acquiring available population health data, then breaking that out into health indicators at the local level, and then into a community-based web portal. Here's how it works. With one click from the homepage, you can access all healthy people categories. You can then search by all county indicators, those with county health rankings, or those with Healthy People 2020 goals. Within each category are all subcategories. For example, one can quickly find chronic diseases and conditions. With one click, all cancer-related indicators are presented by title. Now let's click on an indicator called breast cancer deaths. Here's the key information we present. First, one can see that the county value is 26.9. Immediately underneath that is the state value of 22, and below that is the Healthy People 2020 goal of 20.6. Below the main graphs are key sets of additional information. In dimensions, you can find a wealth of information that breaks out the indicator in far more specific ways. For example, you could see that there's an extraordinary value for women 65 and older, and an even greater value for those 65 and older who are white. This kind of specificity greatly assists local leaders in focusing their efforts at the heart of the problem. Under historical data, one can quickly see what has happened with this indicator over time and thus better understand trends. Additionally, all of the interventions assembled by CDC for this one indicator are then presented so that the local users can immediately find specific recommended strategies for effective intervention. This is in addition to the model practice information assembled by NACCHO, which also is linked to each individual indicator. The indicators also have a wide variety of other valuable information, especially related to knowledge, prevention, and early intervention. For example, we link directly to a library complete with the best-in-class and continuously reviewed articles, along with interactive self-assessment tools, tests, treatments, medications, key decision points, and action items for the public. Also linked are support groups, forums, blogs, and news from all over the country, all connected to this one specific indicator. This type of information is displayed in 16 categories, 45 subcategories, and more than 150 local indicators. Additionally, we have developed the capacity for geomapping at the state and national level. Here's an example. With one click from the homepage, you can see a large map, in this case, the state of California. Within the map are county boundaries, color-coded relative to their own values for the chosen indicator. The map is interactive, so with a scroll over the value ranges, one can immediately see the counties in that state that have those values. Here we can see the counties with the biggest problems relative to this one indicator. Below, we can scroll from the left and see each county in order of severity. We also can see their time trends in the graph at the right. We can see the overlay of several counties to compare the time trends for this one indicator. These interactive geomaps can be developed for any state and for the country as a whole. We feel that this project is a strong step forward in providing valuable and visible information to help policymakers, the news media, and the public move in a positive direction in the making of public health policy for a healthier population.